So the day that me and Kim worked, the day that she had her stroke, neither one of us were supposed to be there. She had actually mentioned to me that she had a sinus headache.
I felt like I had a head cold all week long, and so I was taking medicine for it, and I just went about my day.
I look over at Kim and she's leaned against the bar, just leaned over, and I look at her and she has a smile. So only half of her face is smiling. And I walked up close to her and I said, Kim, are you okay? And when she went to speak, they were not real words.
I felt like somebody was tapping me on my leg, and I thought that's weird because there was nobody behind me.
You know, I asked Kim, are you in pain? And she shook her head no. And she kept touching the one side of her face and kept trying to lift her arm up. And I said, you can't feel them? And she shook her head no. I had other colleagues working with me. One of them said, oh, it's probably her blood sugar. I could recognize pretty easily that it was something more serious, but other people struggled with realizing what was going on. And I looked at the other girl I was working, and I was like, hey, you need to tell the manager to call 911. I need you to get me a chair. And so I sat a chair up against the bar and I sat down on the floor beside her, but she could not speak.
Kimberly was scared, especially when she couldn't communicate what was going on. And I remember reassuring her and constantly telling her what was going on, what interventions we were doing.
She was conscious, and you could see on her face that she definitely had some of the drooping, and she couldn't move her arm, and I was talking to her and she couldn't speak, and she would just, and that's like one of the most, it was like kind of jarring because she was just had a big grin on her face, or half of her face.
Strokes in patients under the age of 40 are extremely uncommon, but nevertheless, we do see them. And immediately walked in, looked at that imaging, and saw that she had a proximal occlusion of the middle cerebral artery. That's a major arterial supply to the brain that supplies about 2/3 to 3/4 of the cerebral hemisphere, or that half of the brain. And so as soon as I saw that, I recognized, no, this is a real serious ischemic stroke emergency. So there are quite a few tools that we have in our arsenal. I thought that in a patient of this age, where I really want to extract the clot as quickly as I possibly can and as cleanly as I can, to give her a complete recanalization so that all of the branches of our arterial tree are flowing normally, Solitaire X was the tool that I wanted to use.
Eventually she got out of her procedure and Dr. Saline came down. He explained what kind of stroke it was and what they did to fix it, and let me know that they were going to take her up to the ICU.
When I got back home, I couldn't do our daughter's diabetes stuff because I couldn't do the numbers. And so that was hard for me because that's normally what I do with her. I had speech therapy, I had physical therapy, and occupational therapy. And they came to the house, and then I had therapy until September, I think.
During a large vessel occlusion, particularly of the first segment of the middle cerebral artery, as Kimberly had, the brain just beyond that is the brain that subserves expressive language or making speech. But it gets better over time and they live very, very normal lives. So Kimberly is able to be an active young woman, is able to be a functional member of society and work, and is able to be a wonderful member of her family and mother. So we use the acronym FAST to remember the signs of stroke. And it's very effective, where F stands for face. You're looking for any sort of facial asymmetry. A stands for arms. Strength in the arms is asymmetric. That is, one is stronger than the other, and you can ask somebody to lift their arms up. Typically what you'll see is one arm goes up and the other does not. S stands for speech, and that is anything abnormal with speech. If somebody's having trouble making language, that is getting the words out. And T stands for time. That is to remind you to call for help as rapidly as possible.
My stroke heroes are Dr. Saline and Jessica and the paramedic that took me to the hospital. I feel like they are my heroes in general, but my stroke heroes for sure. I'm thankful for all of them.